Hey guys, I'm with my good friend Dr. Melissa Wenrich of Nashville Brain and Body. And Melissa and I have known each other for quite a long time. We both graduated from the same chiropractic university in St. Louis. She graduated in 2005. I graduated in 2004, and we got reconnected a couple years ago because we both deal with a lot of neurological problems in our office. We have patients that experience traumatic events in the past, and we both go down the route of neurology. I appreciate what Melissa does because she has different techniques that allows her to delve into the area of neuroplasticity. She does amazing work with prenatal, with babies, with certain techniques to help patients have babies, and hear nothing but amazing results. And I'm thankful that we can refer back and forth, but many patients come in, and I do a lot of acupuncture, which she does too, both certified, and we try to connect Eastern and Western medicine, but the one thing we both like is the nerd aspect of neurology because you can make tremendous gains upon a person's health just by, I don't say simple techniques, but they are simple applications, but they take a lot of knowledge to understand how a person's neurology works. And wanted to talk to her about the whole idea of neuroplasticity, about trauma, about what she sees in the office, because it's really amazing what she can do, especially with the machines and the techniques she has. So it's like a free range. She can just say what she knows about neuroplasticity. But this is Dr. Melissa. She's so sweet, the kindest person, and she knows that. She's my buddy. So anyway, in general, just talk about neuroplasticity, what you experience here in the office.
So here in my office, thank you for coming to my office today. Yes, always love this. But yes, the brain is just a miraculous, complicated system. You know, you take this like most complicated computer server system we have and just times it by gazillion. And that's pretty much what's happening in our brain and nervous systems at any given time, which is, you know, you saying like, oh, it looks like we're applying these simple techniques. But in reality, it's like there's so many levels and there's so many things that we have to think about, or diagnosis and testing and all these things on the front end that we come up with, like, oh, we're doing this little tiny thing, and it looks to a patient like all they did was move my ankle in a certain way, and it's like, yeah, we did that, but like this is doing so much. So the idea of neuroplasticity is not new. We know that the brain can change, okay? If not, we would be stuck in the same patterns over and over and over, and whether that's physical or emotional. So it's this idea that we can have an injury. So I see a lot of patients with concussions, traumatic brain injuries, or even emotional trauma. And so the idea is the brain, we can go from this spot of maybe having this brain injury, not being able to move the body. Let's go with something kind of easy. We can't move this right side of the body. But is it an arm thing? No, it's not. You know, it's a brain thing. So we can come in, do certain techniques. There's a load of different things we can do, but we can retrain and figure out the parts of the brain and then retrain those areas through certain techniques, exercises, strategies, and then we can get this movement back. You know, so that's something very simple and an easy thing we can see. Unfortunately, a lot of times we don't see the emotional part of this, which is why mental health is such a difficult thing. It's a difficult thing.
Do you find that, like, I mean, both of us in practice, many times I find that I'll get progressive with a patient to a certain point, and in kinesiology and in neurology, at some points you'll have to analyze a muscle system. And so in acupuncture, when muscles meet up together, guys, like let's say it's the bicep, which I don't have very big ones, sorry, meet up with the tricep, the connective tissue that actually connects those two pieces actually is a fascial line. And those fascial lines carry electrical signals, which are known as meridians. And what it will find is, if I ever find a hindrance in the contractile force, or the ability of the muscles to strengthen, and it doesn't gain momentum, then I try to go definitely coincide neurology and acupuncture because they work together. But we find many times, we'll talk, and I want to hear some of her stories, where then you'll find a trauma that's been underlying within the midbrain, the brainstem, and she has more experience in this, where you'll find something in their neurology and it has to do some form of trauma where they connected an emotion with that physical trauma. Absolutely. And then you talk to them and then their muscles turn on. Like
it's insane.
It is crazy, isn't it? Sometimes, like you think, we just had to talk about trauma you had when you were 5 years old or something. Like, what are some of the stories? Like, I mean, like...
Oh gosh, I mean, there's so many, but you just like think about that from a developmental standpoint. So just on the fact that like if a child, and we know this with like the ACE study and all these things, we're like, if we have childhood trauma, that is in that critical period where we're developing our brain. You know, babies have milestones so we can track and make sure they're developing correctly.
I didn't know the milestones. This is great.
And that's what we have to go on. So if somebody skipped a milestone, plus you throw on a bunch of trauma, like who hasn't had it? We've talked about this all day in my practice today. Like, okay, 99% of people have had some type of trauma, whether it be emotional or physical. But we develop our brain during this time, and then what if we didn't crawl?
Ooh.
So we didn't connect a certain motor pattern.
Left arm, right leg, right arm, left leg.
And building core and being able to breathe, which that's a whole nother, which I know you've talked a lot about breath. So that diaphragm and that breathing and getting oxygen, so like it goes into so many things. It's not just about that movement that isn't happening.
So you're saying that it's not just movement, but what they're doing is training ground. Like they're training their brain to
movement
grow.
drives function. Yeah. Movement drives function. So if someone is not able to move, we're not going to have function.
Oh, wow.
So just like that, saying like, okay, if that is stagnant in Chinese medicines, we look at like where stagnation is and where things aren't moving. So if we have this stagnation, like you were talking about in this fascial system, the brain isn't getting that signaling. So that map in the brain is essentially turned off.
Oh man. See?
So why do we have that injury over and over?
Because the map and the brain, the connection, they're not reaching each other. So it's like, I try to explain to my patients, but I don't know if it's the right way to explain it. Okay. But I love to say to them that many times, if the signals go into your brain, it's almost like disconnection, guys, where the brain's like, I would help out.
Yes.
I would send a signal back to help you out, but I don't know clear information. Like it's almost like static in the line. It's like, I can kind of hear maybe what's going on. You can still have some movement, but I don't know what the full info is. So you can't create a proper response. But how would you describe it? Is it similar to that? Or?
Well, yeah, and we need to just create that response. So that may look like us doing some things for the brain. So I do a lot of things with the eyes because we know that eye movements and brain function coincide, okay? Oh. And if you look at lower functioning mammals, we can do horizontal, kind of that right and left moving head. But as humans, we get to do all this other stuff. So we have something, we have the visual pursuits, which...
Yes, talk about that. I love, because she has this really cool equipment, like goggles and stuff.
So we have these, so we have this where we can check our visual pursuits, which helps with reading, us being able to look and scan. So if you have, let's say an NFL player, they, quarterback, for example, they need to be able to see the whole dang field. If not, someone's going to, so we have to make sure we can scan. We don't want to be doing these like jumpy eye movements, okay? Yeah. It's out of survival, right? So like that all develops out of that midbrain, and we have to have this head and eye movement going so a baby can't be stuck in this position, or an adult
cannot be stuck in that position, right?
It's not good for the brain because we're not getting all those signals coming in.
So if they have eye movement, let's say they get stuck or they're stalling, does that indicate to you that in those particular stalls, like there's a miscommunication in the brain's not like processing
usually it's not an
information?
eye thing.
Yeah.
I mean, 9 times out of 10 it's not an eye thing because everybody will come in and go, I went to my optometrist, I went to the ophthalmologist. They said my eyes look great, like my prescription's fine. It's like, it's not an eye thing. It's the signaling back because our brain controls all of those.
So do you find that each time when it's a miscommunication, it could be a chemical issue, organ issue, an emotional trauma, it could be one of the files. Right. So we all believe that like the body is a structural being, a chemical, an organ, a psyche, emotional, a spiritual being. And so each stall could be under one of those categories, but we're all intertwined, we're all one being.
Which makes it so hard.
It is. So like if you have like a baby comes in, the baby gets stuck, let's say their head's stuck in a position or their eyes are stuck in a position, you'll see developmental problems with that baby, and then you've done your techniques on them and you see them start to just develop and start to crawl.
So we start to get this movement, because like I said, movement drives that function, especially in a baby. So we get these movements. I work on their eyes, I get their favorite little toy. We try to move. We may do some spinning to help that vestibular system out a little bit. So it's because I can't put my goggles on. We're just assessing infantile some movements.
I love the way she says it.
So cool.
It's so cool because you say you make the baby spin, and we say vestibular. Most people would look at us and go, "What's vestibular mean?" But
we spin. We want to spin. Some kids may spin a lot so they feel like they're part of Earth. You know, like some of those kids that move a lot, it's not that they're wanting to move to aggravate the crap out of the parents. They're moving because they need to know where they are in space.
Oh man.
And that goes, you know, we can dive in, you know, like there's reflexes. Our body and brain works together to develop, and we do it without even having to think.
You know, I think, and I'm not changing subject, we're going to go back to that, like the baby's development. I had a friend one time tell me, he goes, hey, we're in a classroom, and he says, I want you to hop on one foot. Like, all right, we're in there, and I go, okay. Then he takes a racquetball and he throws it at me. And what did I do? I caught it. And he says, you know how crazy strong your brain is? You were hopping on one foot with vestibular apparatus with your head keeping horizontal, horizon level while you could keep balance. Then you could measure the trajectory, the vector, the force of the ball coming to you, and then catch it.
What's going on up here?
In your brain. And you think like that's real easy, like I'm like, no, and then you learn it, and then you see like babies come in and they're like, they can't sit still, they're coming, and you know those apparatuses in their brain to like help train and such.
Yeah, you know, I do my best. Not all, you know, not always. We don't, like we have to, you know, there's a lot of other things, you know, we can, you know, there's the chemical, there's the.
But you like it because you see great results, and like, I'm not saying they're not simple, guys, it's complicated info, but using, like you say, spinning or using your techniques and seeing results where you think, I didn't have to give somebody so many, you know, supplements, or I didn't have to do such, you know, heavy types of treatment on them. And I've had patients that we see both coinciding, and they're like, I love Melissa. It's like one of my patient's friend had told me, my friend told me that her friend had seen you at one time, and they were like saying that they had a problem with their traumas, and at first they were very stoic and said that they didn't know if like the eye movements was really doing something, and then they would get triggered. But they said, man, after 2 months after a treatment, they go, man, I'm not jumpy anymore, and I don't get scared of things coming out at me because I'm not, initiating my fight or flight kind of response. Now, do you have those where people come in and they're like, I don't know what this really is, but then they start moving, they're like, hey doc, I noticed some big changes in the way I respond and stuff and react?
Yeah, it's just really cool because it's always in these things of, it's just, you know, I do things to help you with quality of life. And our main guider in all this functional neurology is Professor Ted Carrick, and he always says, just brilliant of a man. And one of his big things that he's always just preached to us is you ask the patient what their goal is. It's not what we think they need.
Oh man.
It's what they want. So you may see all these things that you think you need to help them with or fix, but they're just coming in because they want to, like, you know, maybe be able to not like jump out of their skin when their spouse walks in the room, or, you know, like they may have like whatever, they may say this, or may like they just want their migraines gone, but they don't care that they can't do A, B, or Z, because that's not what they're coming in for.
They're coming in for that one specific goal,
and we need to help them with their goal.
That's right. That I see that. Do you ever do like when sometimes patients, they would tell us like in school, they'd say, well, you got to find this, this, and this, and I find that a lot of times patients come in, guys, and if you have a problem, when they come in, they're like, I really just want this done. So you touch that area, you find that area, and you're like, and it comes back to even like in Chinese medicine, like we talk a lot about acupuncture, where the body will give you vibrations and frequencies, because the brain is all about vibrations and frequencies, gives you the top priority.
Right.
And if you're listening to the patient, they'll give you what their thing is. And I believe that they make associations with their top priority. So if you unravel that big problem, it trickles down like a spider web. It'll get to all the small problems, and they'll be like, oh, my other problem went away.
And conversely, back up. So with these kids, like a kid that comes in that's apraxic, so they can't speak, so they may be older. I have a few right now, they're like 4 and 5 years old, they can't speak. And we're not gonna go start working on language centers in the brain. I'm gonna make sure they can do these reflexes, and the reflexes that were primitive that needed to be gone at 6 months, a year old, by year and a half, those need to be gone. And the cool thing is like, you get those gone, what do you think the brain's gonna do? It's gonna start doing what it needs to do on its own. It just didn't have the foundation.
Oh man.
So it's not that we have to like go in and try to keep doing this. It's like, get in, and I know someone used to say this at Logan, and I cannot remember what it's like, get in and get out and let the body heal.
That's the truth. That's the truth. It's
like we don't need to overdo anything.
You don't. It's almost where people talk about the innate intelligence of the body. Yes. It's like if you remove the blocks, it's like a battery pack on your phone. If you have too many apps running on the phone, they drain your battery. Swipe off the apps, get all the blocks out, and what does it do? The body will get fully charged. You'll have faster processing speed. It's amazing that technology mirrors neurology. All technology is based on neurology. So isn't that great? So
it's so cool. And I think that's the biggest thing is like and I love, that's why I send all my patients to you. And it's just, how do we get in on these different levels?
Mm-hmm. And then,
like on the cellular level that you're doing and like changing all this, and then, okay, how do we change these pathways neurologically? And then how does all this combine to get this person ready to like work on therapy to handle the trauma? I mean, and it's insane what you have to do to get to a patient. Like, I'm just gonna say this because it's so fun what happened today. Yeah. I had this patient, I've been working with her for a while, and she had some brain things, and we've been working on eye movements and working on, difficulty breathing and some things. And so she's a smart cookie, brilliant. She should be in healthcare and she wants to be, but it's like, do I go back to school now? But she's probably knows more about some functional medicine aspects than I do. It's insane. This girl's brilliant. So she's always in that left, logical, boom, boom, boom.
Yeah.
Never just, I'm starting to see her slowly relax over the months. Well, today she's so fired up about just everything going on in the world, and she's sitting there. I'm like, I have to get you out of this. When's the last time you felt like you were in your body?
Yeah, that's a
she couldn't tell me.
Oh man.
And we're getting her ready because her aberrant eye movements. I'm getting her prepared so she can start EMDR to work on trauma. Because she was in fight or flight and never could get out. Gut issues, all that stuff. So we're working from a brain standpoint to do that. And I could just cry thinking about this. But today we were back there and I'm just like, you're ready. But what did we do today for treatment? We blared The Killers because we found out that both of us, it's our favorite bands.
The Killers.
And we just found this out. And so she goes, what? And I could just see her lighting up. And heart, I got her out of this cortex, and she just got back into her body. And I'm not kidding you, we blared The Killers all during her acupuncture and doing her neuro work today. So I did neuro rehab with acupuncture on the biomat while she was just happy as can be listening to The Killers. And it's there's no protocol for this. I think my point is there's no protocol for any of this healing.
Yes.
Or any of this it's just about the minute. What does our brain need?
And I love it that
what does our heart need?
What does your heart need? I mean, that's what I was the connection between heart and brain, where you said that when you relieve the blocks or release them, it got them set up for EMDR. And I remember we've talked about it because I was doing a thing on brain, and it was a comment, and she made a perfect point. I was driving, and right before I got on the road,
I think you called me.
I called because I got this thing, and it says, I was like, you gotta talk about that, because many times you want to do EMDR, which is eye movement desensitization, but then you think, if that person's not in their body, if they're stuck in this logical left brain and you can't remove the blocks, they may not process the trauma, the emotional trauma.
They're in that fight or flight. They can't do these. They can't do this. And they're going to have sweaty palms. We're going to go into panic attacks. We're going to go into. We're not going to have the fuel in the brain to process the traumas.
Oh, but see, isn't that crazy, guys? When you guys know this, when I was a kid, I had sweaty palms. But whenever I got rid of some. My cheek gets really hot because I get excited, and so when I was a kid, they would get wet. But now, since I've gotten more brain work and more brainstem, got Lyme out, parasympathetics, which was my relaxation, has risen. Hardly have that anymore. But we were talking about fight or flight, and guys, when you say fight or flight, just remember this: it is literally when you encounter stress, it can override your logic centers, get stuck in the midbrain, and make you just sort of initiate this part. I've got to fight something, run from it. Or bear down and just hold my ground and be stubborn. Yeah. And it makes you go into the heart racing, the lungs breathing, and hands can be sweating.
Yeah, and we're not getting blood to the areas to keep us calm. Gut.
And the brain gut connection.
Right? We're not there.
So whenever you find that in a patient, you can see that you're like, because people out there are going to do this. They're going to go, I know I'm stuck in fight or flight, and I know I can't process my emotions. So you work on, let's get you out of the fight or flight first.
Yes.
And then get you in the
because we have to work from the ground up. We can't, and we do it kind of both ways. But it's like, oh, how do we like bring all this together? Because also we have to have our cortex working enough to dampen all of this stuff that's coming at us. You know, and right now this is, you know, if you're stuck in the fear and stuck in the anxiety because of everything, which it is like, you're not alone in that. Like, that's not something to be shameful about, like anything. It's just like, it's reality. And if all of you've known is trauma and you were like almost born in this fight or flight, like your brain's never known anything. So right now, this is just on steroids. And so it is hard to get out of this. But your brain can, you know, like that's the neuroplasticity part of like, it can change and you can rewire, because we are made to be in that rest and digest and sex and procreate. Like that's what it's about. And so like I see a lot of patients for infertility.
Yeah,
of course.
With infertility,
you are, of course.
I'm just
Let's move on. Infertility.
Okay. All right. Live.
We can't get pregnant if we're not even functioning on like to keep ourselves going. And that's what breaks my heart so much, because we get so many families and women in here that have spent thousands of dollars on fertility treatment. It's like, it was never going to work.
Wow.
Because their body wasn't in a state that it could even take care of their own body, much less another human.
Do you find that whenever, like you say, like you can't take care of themselves, because a lot of times mothers will come in and like they get infertile, or if they'll have like a kid or two, if they had a child, and they realize that like they deplete their bodies. They don't know they do with one or two child. They realize how much iron they lose, how much hormones they lose.
And I'm like still in it. I'm a year out, and I know the stuff to do.
Yeah.
Like, this is hard.
It's tough on the body. Hard. I mean, like for them to actually be in their bodies. And when you say fertility, we have many patients that come in, you do too, and you don't realize how much fortification the body needs to have a baby, because a lot of times I think, well, I'll just have a baby and it'll grow. And I'm like, no, it takes a lot of nutrients. And think about how much stress your body has to take. We're saying from the environment, from what's going on, and then your body creates stress hormones, and then that requires energy, and then you want to get pregnant. Do you find when you do the brain work, when you're starting to, and you get them out fight or flight, like you start seeing pregnancies left and right? Because I've heard stories.
This is so cool. Yeah, you just do that, and like and I'm not saying like the patients that are really wanting to dive into this, like they are working hard, and you know that the ones that are showing up for their points, like they are doing the work. It's not an easy like 2 and 3 month process. Like, we are just releasing things from the past. We are putting in good nutrients. We are, we're doing all the things, the thinking and the moving and all this correctly. But I had a patient, like, she's never been able to get pregnant naturally. And so she's always gone through IVF, IUI, all this stuff. And everything shut down when COVID hit, right? So she couldn't go get her neck, which we had been telling her, like, you can do this on your own. Like, please don't do this. I know you can get pregnant. Like, we had been telling her, like, you are so close. Your body is functioning. Like, you are getting to, like, you are made to do this. There was no diagnosis of, like, some physical thing. You know, it's like the brain thing. There's no, like, tumor in there. There's no physical thing. Like, we just have to get the function back. What do you think happened? I had a text.
Yeah.
I just took a pregnancy test and I'm pregnant.
Oh,
and I was like, yeah, you are, because you didn't get to stress out anymore because there was no IVF happening. And it's like, and I don't want people to think that, like, oh gosh, people tell me, like, quit stressing out and you'll get pregnant. Like, that's the most annoying thing you can say to someone that has been suffering with infertility. So I'm not saying that out of, taking that lightly, because it is just, it's a long process. But that's just an example of, are you really checking all these hormones? Are you with a practitioner that's actually diving into this? Because unfortunately right now in our normal medical system of fertility treatment, no one's checking this.
They're not.
No one's even checking to see if, like, vitamin D levels. Like, don't get me started on what's not being checked. That's a whole nother process. So, yeah.
I will say this, like, so we want to talk about, and I wanted just to reiterate and just say thanks, Dr. Melissa, because she's about stress. And there's a thing out there we want to say, it's called the pregnenolone still. If you get under stress, your body can still pregnenolone, which is basically a form of cholesterol, and make cortisol. Yep. Instead of making good hormones, you can stress your life away.
Don't do it.
Don't do it.
Don't do it.
Thank you so much, Melissa. I'm telling you guys, come to Nashville and come to the Brain and Body. Come out here and just experience it, because she does some amazing work with getting people out of fight or flight, using your brain, seeing it on screen, and giving you an example, a format to heal the brain and the mind. And it'll actually help you clear your traumas, okay? So give her a shout, check her out. Guys, thank you again.
Thank you so much.
Oh, she's my buddy. All right, love y'all.
Thank you.
Have a
Love
good day.
you. Bye.